I see myself like a cocktail waiter, okay? And the patient presents and tells me what kind of, we work out what kind of thing is needed. And now it's up to me to decide how much of this is going to be pharmacological, how much behavioral, how much technological, and we make this mixture that's unique to that person.
Managing anxious patients is not only one of the most difficult things in dentistry, and sometimes they can be very stressful encounters, but they are actually some of the most rewarding experiences. Sometimes this defines us as dentists, a dentist who cares, a dentist who can really give people hope. People lose hope, and that's part of their anxiety. They won't know if they will get along with you, they won't know these patients if they can ever trust another dentist again. They are too scared of pain, they're too scared of just general dentistry. And I think if you could master the art of treating the anxious patient, you will be so busy, profitable, but more important, your value and your sort of self-worth as a dentist and enjoyment and fulfillment can really increase. And that's why today on this episode, Protrusive PDP050, episode 50, raising my bat. Thank you so much for sticking with me all the way 50 episodes. I've got an amazing person, this clinician, Dr. Mike Gow. If you've ever met him, I met him in the Smithson course a few months ago, and man, this guy is just something else. Like, here I am, right? I'm placing local anesthetic sometimes when I'm placing retraction cord, right? So I take the temporary crown off and I need to get a scan or impression to go to a definitive crown, for example. And I'm placing local anesthetic for retraction cord. Yeah, I'll put my hand up. I do this sometimes, right? Whereas this guy, okay, Dr. Mike Gow, he's worked with dentists alongside him, and through his hypnosis and just amazing management of anxious patients, their team have managed to place implants and do sinus lifts without local anesthetic. Yeah, you heard that right? Without local anesthetic to do a surgical procedure and place an implant, that is amazing. I'm not saying you guys should aspire to that level, but don't you think we can learn so much from Dr. Mike Gow? And just even as a GDP, if we can learn a few tips from this episode, which is absolutely jam-packed full of it, it will really help you in the management of nervous patients. We ask about Mike's journey, how he got involved with nervous patients, what his top tips are. He explains what he was feeling like just before he was about to operate on this patient when placing the implants without local anesthetic. Like, that's a big ask, and a lot of these were being televised and filmed. So it was a lot of pressure for him and his team, but it's just amazing the outcome. And we sort of find out what kind of patient is suitable for going as extreme as that. Yeah, not everyone is suitable, and it depends on a few factors, which Mike covers fantastically. So I'm really excited to share this episode with you. The protrusive dental pearl I have for you may change your life in a massive way. Like, it changed my life in a massive way, right? When you're sometimes doing treatment plan letters at home and you need to just see an x-ray, or you need to see exactly what the conversation was with the patient, you need to read your notes, right? And let's say it's a weekend. Sometimes I'm spending weekends doing treatment plans, as you know from the previous episodes. So how can you access the notes? It's been something that really bugged me for a long time. So we use, in the UK, a lot of people use SOE Exact, and no matter what system you use, you can download something called AnyDesk. Now, AnyDesk will allow you to access any other desktop or computer or laptop that's got AnyDesk involved, and it's like completely secure. So you've got these like long keys, passwords, encryption, all that sort of stuff. And then now you are able to access your work computer. And if your work computer's on, you can then log into your dental management, patient management software, and you can look at your x-ray, you can find out emails of patients, so you can email them a treatment plan letter. And that literally really helped me so much in terms of saving time in ways you couldn't imagine, and also so I'm not constantly hassling or bugging the receptionist to send me this email or send me that piece of information or show me this x-ray. So now I can just do it myself. You take the burden off the reception team. So if you ever wanted to know how can I access that information while out and about or at home or at a different practice, I would download AnyDesk on your laptop or computer, and then also the work one, and it's really easy to use. So I really hope you enjoy AnyDesk. I'll put the link for it on the protrusive.co.uk website under the show notes of this episode, but also on the Protrusive Dental Community Facebook group, which has been just amazing recently. So much activity on there. People are really embracing the term Protrusive, which is awesome. I'd like to thank Enlighten Whitening for their support in sponsoring this episode, and they're a premium brand of whitening that we use, and it's just phenomenal. The patients get a really great response, and it's more about the feel that they get, that, hey, I'm actually using a quality system. The tray design is just on point. It's a really like thicker trays, which have, it's like a super seal effect. And so whenever I fit these trays, I'm always impressed at the seal that's achieved. I was really impressed the first time I used Enlighten a few years ago, that when the pack came in the delivery, there was like this cold pack with it as well. Because of course we know that it's so important to keep your carbamide peroxide or hydrogen peroxide cold, right? So we instruct our patients to keep it in the fridge. So I was impressed that even in transit, these gels are being moved around with this cold pack to keep the gels at the right temperature. And I think that could be part of the secret, if you like, as to why Enlighten it performs so well and why people get such great results with it and why they can give this B1 guarantee. Whether you use Enlighten already or using an alternative whitening brand, I think you can learn a lot from Payman Langrudi. He does a 1-hour training on teeth whitening, and of course you'll get to learn the benefits specifically about what makes Enlighten unique as a premium brand of teeth whitening. So if you go to protrusive.co.uk/enlighten, you'll be taken to the page where you can sign up for the 1-hour free training with Payman, who will be coming on the podcast soon, because I want him to talk about these things, and I want to make it controversial. I'm going to probe him and prod him and try and get out, find out, is the light, we know people use the in-chair lights on the teeth, is that even worth it? Like, we sort of kind of know the answer, but what's the sort of history behind that? Are practices still doing that? What makes whitening more efficacious? Is that the right word? How can we do more whitening? Like, whitening is such a, I want to say an easy procedure, but it's like it's a reversible procedure. It's so safe, and it can really, really uplift patients and give them a much improved smile compared to doing invasive procedures. So it's something worth checking out. So go to protrusive.co.uk/enlighten to check that out. So again, thank you to Payman and the team at Enlighten for sponsoring this episode. And we're going to dive right in with Dr. Mike Gow.
Mike, welcome to the Protrusive Dental Podcast. How are you, my friend?
I am very well, thank you. How are you?
Fantastic. And I'm really, really excited to talk about all the themes we're talking about today. I just think it's crazy, right? I'm going to say it now. I think it's crazy that you can do treatments without local anesthetic. And I know I'm sort of jumping the gun a little bit, but I mean, your sort of claim to fame for me, for bringing you on, is that amazing accomplishment for anyone who doesn't know, and we're sort of setting the scene here, is, I mean, here I am using local anesthetic to place retraction cord, right? And you have been involved in sinus lifts and immediate implant placements without local anesthetic. And we're going to talk about that today, and we want GDPs and dentists all over the world to learn techniques to manage nervous patients. But what you achieved with that is just mind-blowing. Before we jump into that, just tell everyone a little bit about yourself, where you practice. You have a beautiful practice in Glasgow called the Berkeley. Tell us a little bit about just you.
Yeah. So yes, I qualified in Glasgow in 1999, and actually got a really keen interest in anxiety management right from the beginning of my career. Even as a student, I was interested in anxiety management. I did my dental elective in hypnosis as well back in those days. And I'll get into that story a little bit more shortly. Over the years, I've got a master's in hypnosis, applied to dentistry from University College London, postgraduate certificate in the management of dental anxiety as well. So yes, but you know, my practice is the vast majority of my patients either are or have been anxious at some point in the past. So that's really the main core of the work that I do with anxious.
What attracted you to that? I mean, you said from very early on as a student, but why that? Why not orthodontics? Why not this? You're essentially everything to a very large number. You're there everything. You are their orthodontists. You are, I don't know if you do any ortho or not, you're their oral surgeon. You're a lot of services to certain people who will probably refuse to go to anyone else, because you know, when you have an anxious patient and they like you, we know that they will stick with you. So what is it did you know that, hey, this is really important in my career, that could be my USP? Or is there some other factors that made you, drew you towards the management of anxious patients?
Definitely. I wasn't, I guess, business-minded enough at the time just to realize that actually it was a great USP to have. What it was, actually, there was a patient of mine as a dental student who was on the student clinic who shouldn't have been. She was terrified. And all I was doing was making her a set of dentures. And I still remember to this day all my student colleagues, complaining about patient management and struggling to do certain things clinically. But at the end of helping this particular lady, she was so grateful that I'd got her through her treatment. She actually gave me a little Parker pen. Now, this lady was not well off. She was a little old Glasgow widow, And at the end of the treatment, I got this silver Parker pen with Michael engraved on the pen. And she gave me the biggest hug and said, "You've changed my life." And from that moment on, I thought that's what I want to do. I love dentistry. I do love clinical dentistry, but I love that feeling of changing somebody's life. And with phobic patients, often people that haven't been to the dentist for often decades, they have no social life. They're struggling finding work. They're struggling to find a partner. They've got low confidence, pain, unable to eat. And they've got very low expectations. They think their life cannot change. And to be able to take somebody through that journey to a point where they're out of pain, they can chew and they can smile again. And it's just it's a privilege and an honor to be part of that journey with somebody. So that's where I get my buzz and my kick every time is from how it changes people's lives.
I can definitely relate to that buzz. I mean, I think all dentists, all dentists who mean well, who have a kind heart and gentle hands, who the kind of dentist that puts topical anesthetic, there's some who don't and some who do. And I just automatically divide those two groups. And I think those who do, maybe I'm saying things I shouldn't be saying, but I think those who place topical care more than those who don't. That's just
Here's my perception of it. Here's my thing about topical, since you raise it. It is, first of all, you've got to put it on for at least 90 seconds. So make sure the stuff works, give it a chance. But by using topical anesthetic, you're telling your patient you care and you'll go the extra mile. And for that minute and a half, you'll buy appreciation, you'll buy the patient's comfort. It's so worth doing every time. Even if the patient's not nervous.
That's exactly my mantra. And, so anyone listening out there, you don't use topical, just use it. It just makes sense. It shows that you're a caring dentist. It's a no-brainer for me. You probably have a Mike, and just tell me, just because it's fun to know, where is the furthest a patient travels from to come and see you?
Oh man, that's a question. I get patients from over Europe, actually. So sadly, I had a patient who was due to see me from France, but of course they've not been able to come. So I think probably European is the furthest. But again, this is one of the things. Yes, patients will travel, but part of what I want to do, I don't want to create a patient who believes that I'm the only dentist that can ever treat them. It's great for my ego. It makes me feel nice if that's the case. However, it's not very useful for the patient if we go into lockdown or there's a pandemic or I'm ill or something. So a big part of the journey I take the patient through is to rebuild their own confidence, their own ability to see how dentistry can be. And once they know how dentistry can be and that they have control over it, I will frequently recommend patients to see other dentists, and especially if it's someone I know, I'll take them on the first part of the journey, get the majority of the treatment completed. I've got a lot of patients that will travel from England to see me. I find out where they are, and of course, dentistry is a small world. I will know somebody local to them who I know is an excellent dentist, and I say, look, go and see Jazz. He's a great guy. He will look after you. And then they're not having to come and see me every 6 months. So yes, patients travel, but I'm not for a minute saying that that's how it should work.
That's very admirable. The fact that you look for that arrangement, that you want to build up their confidence that they can see anyone, and that's the real hallmark of the patient. The dentist that really cares about their patient going forward as well, because quite rightly said that you don't want them to become too dependent on you. And I think it's great that you take them through that process, and that's amazing. So talking of processes, tell me, how do you get to a point where you even have the thought of doing a sinus lift without any local anesthetic? Like I'm afraid of the rubber dam clamp to pinch the palatal gingiva and them to sort of feel it, and you're like all these surgical things. So tell us, tell us a story behind that. Wow. I mean, I can just only fathom all the different skills that you need to do that. But how do you do it?
Well, I think I guess one of the skills is just having the bravado to say, let's make this happen and do it, because. As you know, you can use local anesthetic and the patient may still feel something. So one of the questions that people often ask me is, what would you have done if one of those patients had felt something? Well, guess what? That's what we do every day. You know, we're in that scenario all the time. The patient might feel something at any point. It was exactly the same. So I guess, you know, first of all, talking about pain management. Pain is unique to every individual who's alive. It's a very, very complex thing. You know, not only physiological, but emotional, expectation, history. There are so many things wrapped up in not only the experience of pain, but the interpretation of actually what that means. You know, the word pain in itself, actually, the origins of it means punishment. And you get words like penalty and penitentiary and all these kind of words from the same origin. So it's associated as a very negative thing. So the first part of that journey when preparing a patient for something like that is to say, look, here's the procedure that we are going to do. The reason why we are doing it is to achieve your goals of promoting your health, promoting the aesthetics, you know, listing through all the reasons why they're doing it. Now, during that process, your body will give you signals to tell you that there's danger, something's happening, there's a surgical thing. However, you know that this is all constructive, it's all healthy, we're doing a good thing by doing this, so you can interpret that signal differently. So that's kind of part of the introduction to how do you interpret these signals. Now, if you watch a lot of people talking about pain management for surgical situations using hypnosis, the mistake that's often made is they talk about saying you will not feel anything. Mm-hmm. Okay, now I would never even say this if a patient was having local anesthetic, or you won't feel anything, because you do. Of course you feel something, but you're going to feel pressure, you're going to feel vibrations, you're going to feel X, Y, and Z. So yes, you'll feel something, but you'll be surprised how comfortable it is. Now, actually, if anybody ever watches the video that I did with Phil Friel, which was the immediate implant placement, throughout, and it's on YouTube, throughout the procedure, I'm saying to her, you know, lots of pressure, you're feeling pressure, vibration, movement. And at the end, the interviewer says to her, so how was that? You know, what was it painful? And she says, no, it was just a kind of, and she looks for a word and she says, it was a kind of pressure feeling. Mm-hmm. And that's the words I was using and feeding the whole time, interpreting it differently. So first of all, for an extreme procedure, it would be quite difficult if the patient was extremely anxious, because that anxiety would drive the pain. We know the more anxious somebody is, the more pain that they interpret. Now, if you take an MRI scan, the fascinating part of pain research shows that this is not just the person saying, I feel that painful. When you look at the functional MRI scan, their brain is firing. And these are the cases sometimes where, you know, the patient's in the chair, you barely touch the tooth, or you take out a bit of cotton wool. That was sore. What did you do? Okay. Now, the chances, I mean, maybe there's an accessory nerve supply, maybe there's something else going on, but there is a chance that the patient has actually generated a pain response within the brain, despite there not being a physical reason why it should happen. The pain is just as real, it's just as painful. So, you know, the big mistake would be to say, you couldn't have felt that.
But Mike, honestly, I've had these patients whereby literally I'm hovering the needle above the buccal cluster premolar, about to give the infiltration, and they're like, and you know, you think, oh my gosh, you know. But these are often, you know, in my experience, very, very anxious patients. These are the ones that you're taking out a lower molar, for example, and you've given 4 ID blocks and 3 articaine infiltrations, you've gone lingual, and then just as you start putting any pressure on, they're screaming. So my natural instinct, most dentists would think, hey, you know what, this patient's just full of BS. But are you suggesting that actually that there is activity in the brain that matches up with real perceived pain?
Yeah, 100%. I mean, first of all, never make the assumption that there's something that you've missed. There could be an abscess, there could be accessory nerve supplies, there could be a reason why they genuinely are feeling something. But I do believe in a lot of cases, especially in very anxious patients, their anxiety drives the expectation and the experience of pain. But it is very real. it's psychologically generated, but it's just as real as if it was physiologically generated. And that's, that is something that we have to be super, super aware of.
Was it NLP? Did you use NLP, or have you sort of done a program learning about NLP, or is it purely your sort of hypnosis background that you're able to get a patient like that? And also what I want to know is, would you be able to take me, for example? I'm not dentally anxious, at least I don't think I am. And would you be able to condition me to potentially have a extraction, for example, without local anesthetic? And not that way, I want this to go too much in that direction, because I want this to be really helpful for GDPs, and most of us are not going to start doing this, but I think there's so much we can learn from what you do.
Here's the thing. Being hypnotizable is mainly about somebody's creative imagination and their creative ability, as well as expectation and motivation. Now, somebody who's highly phobic, highly anxious, and is able to generate the experience of pain despite the fact you're doing very little is probably quite hypnotizable, okay? Because they're already doing it. They're doing it negatively, okay? So for those patients, I know that yes, hypnosis can help. Now, could I hypnotize you? I've got no idea. I would need to know a little bit more about you. On a general assumption, if I know that you are creative, artistic, all those types of things, then I would guess yes. If a patient presents and says to me, Mike, I'm a professor of mathematics at the local university, could you hypnotize me? I'm thinking probably not, because he's going to analyze everything. And rather than going with the creative experience, you're going to be questioning what's happening all the time, and it actually stops you engaging with the experience. If someone says, I'm an artist, a musician, they tend to be far more hypnotizable. But actually, as I say, if someone says, I have a phobia of spiders, flying, water, the dentist, can I be hypnotized? Then the answer is yes, because you're already doing it. So it's a beautiful self-selecting group of patients. If someone comes and says, Mike, I have a phobia, can you hypnotize me? Yes, is the answer.
That's crazy, because automatically I assume that those two patients that you've done in immediate placement, sinus lift without LA, I thought, hey, these are not the extremely nervous ones. They're probably just normal guys that you sort of said, hey, it'd be really cool to do this. But actually, what I'm understanding now is actually you need that patient who generates those sorts of connections, neural connections that are amenable to hypnosis. So those two patients were, most dentists would see them as phobic patients.
Not necessarily. One of them actually was quite anxious originally. The other wasn't. You don't need to be. You don't need to have anxiety to be hypnotizable or phobic. You just need that creative ability. Mm-hmm. And most people who are anxious or phobic have that, but you don't have to have the anxiety element. There's plenty of creative people that don't have anxieties. So it's more the creative ability that's important.
Brilliant. So now I want to get the learning done here. So you've talked about these amazing experiences, and if you send me the YouTube link, I'm sure lots of people want to see this. So I'll put that on the show notes on protrusive.co.uk so people can check it out. I want to know, what are some pieces of advice that you can give to dentists listening right now to help us tomorrow manage anxious patients, because anxious patients, phobic patients can be a blessing in terms of, they're patients for life, so rewarding, the great feelings that you get, the hugs that you get, the lives that you can change, but they're also the reason you run 45 minutes late, you have to get the tissues out and give it to your patient, the nurses roll their eyes, all that sort of stuff. They're also, they generate a lot of emotions in dentists.
I think, and you're right, but each of the things you've mentioned there are things that you would address. So first of all, creating an ethos among your practice of caring for the patient, and actually understanding that these are a really rewarding group of patients to help. I think, scheduling them at the right time, good communication with care coordinators, all of those things go a massive way, and it gives everybody, it's not just me that gets the job satisfaction, it's the whole team can genuinely, invest in this and feel like they're part of changing this person's life. So make it a team thing rather than just being about the clinician themselves would be one thing. So ensure that the staff who care around you are also getting the training in communication and sedation techniques and whatever else you're going to offer. I think having time and flexibility would be the second thing. So I would always avoid, if I know somebody is very anxious, I would always avoid squeezing it in. For me, still the hardest patient to manage is a phobic patient in pain, squeezed in for 15 minutes. I mean, that is hard, no matter how many NLP or hypnosis courses you've done. That's still going to be very tough, because a patient will pick up on the smallest cues of you feeling under stress or pressure or trying to rush at something, and the whole thing can just spiral and get out of hand quite quickly. So time is really important. And then train. This is one of the things I found interesting when I first embarked on my journey. Dental anxiety management seemed to go in one of two directions. So either you were a sedation dentist, or you did the behavioral, CBT, hypnosis kind of side of things. And actually, I found these two different arms very rarely interacted and talked. It was either the sedation clinic or the hypnosis clinic. And for me, truly to help a phobic patient, it's about selecting the right mixture of all the things that we can do. We've got clinical techniques, injection techniques, learn how to do an Akinosi block, learn how to use computer-controlled injection systems like the wand. Make sure you can get a tooth out. There's very little point in me talking a good game and relaxing a patient, and then I can't get a tooth out. So all of that is important. Technology that we have, from CAD/CAM scanners and impression-free dentistry is huge as well. Training in the pharmacology, so training in sedation techniques, inhalation, IV sedation. That terrified me. I was interested in being understanding the psychology of anxiety, but I knew if I truly wanted to help anxious patients, I had to train in IV sedation. And it was one of the best things I ever did, because, in the right case, IV sedation is phenomenal. And then even on the behavioral side, you have cognitive behavioral therapy, hypnosis, NLP, basic relaxation techniques, communication skills, all of these things come together so that when I'm presented with a new patient, I don't just think phobic patient sedation. I see myself like a cocktail waiter, okay? And the patient presents and tells me what kind of, we work out what kind of thing is needed. And now it's up to me to decide how much of this is going to be pharmacological, how much behavioral, how much technological. And we make this mixture that's unique to that person. Some people, it's a pint of vodka, it's you need IV sedation and we need to get this done. But it's always going to be a unique mixture for that person. So that, I think, is probably the biggest message that I have for people is, train in as many of these different little branches and ingredients as you can, because the more things you've got to reach for, the easier the treatment is going to be for the individual. And that's part of, a few years ago, we developed the International Society of Dental Anxiety Management. And the whole thing about that was trying to have a platform and a place where people could learn lots of different things. So last year we had a conference, and we had people teaching injection techniques, people teaching rapport skills. It was just wonderful. So that's the type of thing that again gets me excited. And there's nothing, you'll know this yourself doing teaching, there's nothing more exciting than another dentist coming back saying, that thing that you told me I used on this really phobic person who had been struggling with, and they're now okay. And that's hugely rewarding as well.
That's fantastic. I really love the cocktail waiter analogy. That's just phenomenal. I really love that. What percentage of your day is sedation? What percentage of your day are you actually delivering intravenous sedation?
I would actually put that as a percentage of the week more than a day, because I maybe have a session a week or every couple of weeks. I don't do a huge amount of IV sedation, maybe using inhalation a little bit more. Especially just now, IV sedation is just a bit more complicated with, chaperones and around coronavirus. It's just a little bit harder. But I find maybe once a week or once every couple of weeks. And generally, these are new patients that are needing a high volume of surgical treatment, so multiple extractions or multiple same-day crown placements, using the trios. So we're, yes, the big disadvantage really with IV is the patient has no memory of the treatment. Now, your patient's going to say rubbish because I don't want any memory of the treatment. But if they have no memory of the treatment, then they've actually got no foundation to build their future experiences on, saying, look, that was actually okay. So great to get things started, but it doesn't necessarily help to cure the phobia in the long run.
It doesn't take them through that process of becoming less dependent on you, but it's a good starting point for maybe a surgical procedure that they're not maybe something that you probably want to do on the sedation as well. And when you take them through that journey and they become more trusting and they can open themselves up to other treatment, and you've probably got, obviously, as you said, your whole practice is geared towards that, which is amazing. So Mike, I just wanted to touch on inhalation sedation. A couple of years ago, I thought before then that inhalation sedation was just for children, right? And I got beat down on Facebook by some eminent educators in inhalation sedation that this is absolute rubbish. It's actually used for adults. And that's when I learned, hey ho, there is actually a place for inhalation sedation for adults. So tell us, just can you bust that myth for us about inhalation sedation and how much of an impact, how much can it actually help your patients?
Inhalation sedation, I think, is probably one of the most underused anxiety management tools that we have at our disposal. I believe just now, I may be wrong, so please let me know if I'm wrong, but I believe we're the only clinic in Glasgow that is offering it at all. And it's so effective. I mean, it's great for kids, works very, very well with kids, but for adults as well. It's perfect for short, minimally invasive procedures. I don't know if you've ever experienced Nicest yourself before.
I have at dental school. They give us in fourth year. They give us a little go, and it felt amazing. I felt like I was 4 pints down, but not in like you're kind of 4 pints down, but you're not going to get a hangover, and you feel fresh. It felt really good.
Indeed, this is how I explain it to patients. I know if it's a parent of a kid, you've got to be really careful as well. So I talk about it being a happy drunk feeling, and then I make sure I explain to the kids that with alcohol you can feel sick, violent, you can get depressed and upset, but with happy gas, it's called happy gas because it makes you happy. But it's got me out of many, many difficult cases in the past. It's occasionally even cases booked in for IV where we've not managed to find a vein. The patient's then being able to proceed with inhalation and actually got on okay. It's very, very safe, very, very easy to use. And, it just makes me think, why would you not have this? It is not that expensive to set up in practice. Very, very easy to do. And you can find training courses through SAD or the likes of Richard Sharon, who offers training courses in inhalation sedation.
Yeah, I'm glad you mentioned Richard. It was actually Richard Sharon who beat me on Facebook about that. but thank you, Richard, because you taught me something, and hopefully people listening right now who may have thought, hey, inhalation equals children. It's not the case. Inhalation sedation is widely used in those clinics that use it on adults to a great deal of success. So moving on, yeah.
I was going to say just very quickly, when I in my VT practice, they had inhalation sedation plumbed in. It was in a little town called Callander, which is up in Perthshire near Stirling. And I always remember my trainer said this wonderful line to me where he said he loved using nitrous oxide for his patients. He said, you're anxious and your difficult patients, they need it, but your good patients, they deserve it. I've never forgotten that.
That's fantastic. So your VT practice, you were a VT there, and they had inhalation sedation as well.
Yes, I was. I mean, that was great for me. I was able to use it, straight from the off.
That's amazing. I mean, that reminds me of the film, the book Outliers. How the fact that both Steve Jobs and Bill Gates were both born in 1955, and therefore, when they were at a certain age, they were coming computers. And then for you in your journey, the fact that you're already interested in that, and then your VT place had inhalation sedation, so that only fed fuel to the fire.
It
so
does.
That's amazing.
If you read Matthew Syed, he talks about that as well. Black box thinking. Becoming a table tennis champion, but actually the top 10 players in the UK all came from the same street because that
was Bounce. Matthew Syed's Bounce.
That's it. Indeed. So, but that is true. So the inhalation sedation, as I say, it's well worth doing. And actually, and again, I would never say get into anxiety management for financial reasons. However, the fees for doing nitrous oxide are actually fairly reasonable as well. And not only do you get remunerated for what you're doing, it makes you faster as well. So for a small amount of downtime at the start while the patient is starting, because it takes a few minutes for it to work, you've then got a far easier, more compliant and more relaxed patient, and the procedure goes a lot faster. So there's a business model in that as well, which is well worth looking at.
Well, I'm glad you mentioned that, because then that can lead nicely to another question I want to ask about businesses. Look, when you're marketing, because you're amazing at managing anxious patients, you've built a whole practice around it. You've trained and invested in your staff from the way they handle phone calls, the way they greet them. I'm sure all bases are covered. So now you've invested in your team and you invest in yourself. How do you attract the right patient that will really benefit from you? Is it just purely word of mouth, or do you do some marketing within Glasgow? And how do you, I'm sure, correct me if I'm wrong, but the patients from Europe and that sort of stuff, I'm sure there's loads of word of mouth going on, but do you advertise?
We do a little advertising. I don't need to do a huge amount for the anxiety management. What was interesting, actually, when I first came to the clinic that I'm now in, it was a bit of a leap of faith. I'd been working in a mixed practice until that point, and while I trained in the hypnosis and the sedation. So when I first moved to the Berkeley clinic, there was no list, and I thought, this is me. I'm going to establish as an anxiety management dentist, and I really had no idea, is there a big enough private market to sustain this? When I knew that 30 to 40% of the population were anxious. But I wondered, are there enough of that population that are prepared to pay a private fee for it? And more or less instantly, the books filled up. There's a huge market for anxious patients. So with regards to marketing, you're right, a huge amount is word of mouth. A huge amount actually came from the website that I originally developed. I started a website as soon as I qualified called whatfear.com, and it was mainly a patient education.
Which year was that, Mike?
99.
Wow. So that's really great. That's so early.
Yeah.
I don't know, when was Google started? I don't know, but that's really good.
It was right at the start. So actually there were lots of mental health and self-help forums ended up linking up, because mine was pretty much the only dental anxiety website out there. So it's become a bit more business-like and about me, rather than a general thing about anxiety, because there's better ones. Dentalfearcentral.org is a great one to look at, and it has everything in there. So the website helped. Actually, I got involved in helping on Dental Fear Central, so answering questions to phobic patients, which of course is a free of charge thing. That's difficult because it takes a lot of the time, but when I still get patients who have read responses and things that I've written within the forum helping other patients, who then know that I'm caring and sympathetic to anxious patients. Of course, then social media latterly, is a thing. But I think the anxiety forums is probably the main thing that generated a lot of the business originally.
That's really fascinating. So there we are, forums as they were, and obviously now so much of it's word of mouth. You're probably the go-to clinic for that kind of stuff, which is great. The next question I'll ask is, now we're getting to a bit where we've got to squeeze all this content in, people are listening and they want to find out more. So now I want to find some learning points. So your name is Mike Gow, and I know there's something called Gow Gates. Did you come up with the Gow Gates?
I wish. and do you know, the frustrating thing of that is I prefer the Akinosi block. The Gow Gates is a bit harder. The chap who came up with it, his name was Gow. He's an Australian dentist, and the Gow Gates, the hyphen, was his tutor. So Gates was his teacher.
Right.
So Gow Gates is in honour of his teacher. I
didn't know that. So can you just, for those who don't know, what is the difference between a Gow Gates and an Akinosi? And let's just focus on one. Let's focus on the Akinosi, because you said that you prefer it. Obviously, we can't video demonstrate exactly what it is. But if you just give a brief description, but then more importantly, if I want to learn Akinosi, I don't know how to do Akinosi. What's the best way for me to learn Akinosi? So just cover that, the difference, and then how to learn that.
Okay, so the difference, the Gow Gates block is an open mouth block, and after it's delivered, the patient has to stay open for a considerable amount of time, and often you need to kind of massage and try and move the anesthetic around. So for a lot of the time when I want an alternative block technique to an ID block, part of it is a problem with access. There's maybe difficulty in seeing landmarks, so maybe the patient's a bit overweight. Or they have a large tongue, a gag reflex. So the open mouth techniques are difficult in these cases. The Akinosi is a closed mouth block, which is what makes it so superb. So you can use it with patients with limited opening, huge tongues, gag reflex, poor anatomy. Most of us have probably given an Akinosi inadvertently at some point in the past when you've been anesthetizing an upper 8 and the patient says, my lip's starting to go numb at the bottom. You've kind of done a high block by mistake. So to do the Akinosi, you're still using the same needle as you use for an ID block. Retract the cheek, ask the patient to close, and you're actually going in at about the height of the apices of the maxillary molars, about the mucoperiosteal fold. So that's the height you're going in. You advance the needle hub to about where the distal of the 7 is. And you're actually giving, there's loads of YouTube videos on this as well, so you're actually giving the block much, much higher. Now, one of the reasons it's not taught to us at university is there's no bony contact, so there's no guarantee of exactly location and where you are. So again, you need to make sure you're aspirating, you're not in any structures there. I've never had any issue with it, I have to say, while I'm doing it. And again, because you're not going through muscle tissue as you do with an open mouth block, it's far more comfortable as well. So if I know I've got a needle phobic case, I'll sometimes, that's my go-to as well, because I know it's going to be more comfortable and the patient's not straining to open while we're doing it. So yeah, please definitely learn the Akinosi. Learning it, certainly there are YouTube videos to look at. We do having clinical training where somebody's supervising is of course the ultimate way of learning anything. So certainly look on your portals, look online for your CPD courses and see if anyone's teaching it. We may well run something through ISDAM at some point in the future if there's interest. We can get a clinical.
I'm sure there would be, Mike. Never underestimate the basics and people want to get the basics right. And I think there would be demand for that, especially because, I remember back when being a second year student and how I'm sure we all feel petrified of getting our first ID block and your glasses steam up and you can't see anything and your hands are shaking like this. And now I'm going to a stage where, most dentists can do everything with their eyes closed. But when you're trying to do a new technique, even though it's so familiar, it can be really scary. Like, for example, I once read, and maybe you can tell me about this, I once read, I think it's like Dental Update or BDJ, that a technique to get your patients to feel their ID block less is that you get into position, and instead of you inserting the needle, you get the patient to turn into the needle.
Okay.
But even that, I don't want to change. I don't want to change anything, right? So it can be quite scary actually when you're first sort of doing that sort of stuff.
Certainly with infiltrations, I'll move the tissue onto the needle. But my worry with asking the patient to move their head is somebody's surely going to jolt their head one day, or you lose control a bit over it. So that would be my worry with that particular suggestion.
Exactly. That's why I haven't done it. But it was an interesting thing to read actually. Go on. Sorry.
I was going to say, the Akinosi is simple. It's not difficult. It's very straightforward. It is like doing an altered infiltration, essentially. So
I'll find a good video on YouTube and I'll link it as well because people like to see that sort of stuff. So we've talked about how you track the anxious patients.
Well, you're going to say as well, just before you move on, the first ID block that I ever gave, and of course you're trying to get rid of the shakes, and I'm in position, working out my landmarks, the anatomy, and inserted the needle, found the bone, coming back, and it's just as I started to press the plunger, a wasp landed in my ear.
Wow.
So I just very slowly withdrew the needle and then went, ah! that was my first ID block. And I'm
sure everyone's got a cool story. Everyone always remembers their first time they did whatever, so your first ID block. I remember my first ID block very well. And so that's a very unique story. I like that a lot. So last couple of questions now, actually. One is tapping back into that story of you doing these procedures alongside a colleague without local anesthetic and depending on hypnosis, which is just still mind-blowing, right? You had some TV coverage. I believe you had like a TV setup, some camera people come in. Yeah. How did that happen? And what was going through your mind during that? Because, there's a professional team. And if it goes wrong, then it can be very embarrassing. What was going through your mind?
Okay, well, first of all, there's been a number of things we've done. So there was a kind of progression to the story. Hypnosis is an unusual thing. As you've heard, it's just one of the bows in the bag, one of the arrows. There's lots of tools that are used, but because it's more unusual, I've kind of become known as the hypnosis guy, but that's just part of what we do. So, I did, I experienced some amazing things with hypnosis. In that same first year, when I was working in the clinic with the Nicest, there was a little lady that came to see me who had chronic pain. We couldn't find the source of it. I referred her to the pain specialists. They wrote a letter back saying it's probably psychogenic. She saw all sorts of pain specialists, had medication. And I said to her, I'd done this basic training course in hypnosis. And I said, hypnosis can help. And she just looked at me and said, I don't think so, sunshine. And about 3 months later, her husband came back in and said, look, she is crying herself to sleep every night. She's in so much pain. Could you try hypnosis with her? So, of course, I got all my books ready, wrote up lots of techniques, and I was supposed to see her for her assessment. So she came in for this assessment, and on the day she's in tears. She said, I can't stay for long because I'm in so much pain. I just need to go. So I said to her, look, can I teach you a really quick technique? And it took all of about 10 or 15 minutes, a visualization technique of imagining her pain was a number on a dial. I asked her if she could visualize the dial and just turn it up very slightly. So the pain was just slightly worse for a few seconds, and then turn it back down to where it was. It's really easy if you focus on pain to make it worse. Turned it up and then back to where it was. She could then turn it down by half a number and then a full number. So we played around for 10 minutes with this idea of the dial, and she went away. I then booked her next appointment, and I started phoning the folk that trained me, my dad who works in hypnosis, and I got all these ideas for the techniques and skills. She came back in the following week and said, I've come in for my appointment, but you're going to be a bit annoyed because the pain's gone away. I don't think I need this appointment. And I said, really? What happened? And she said, well, I went home and I was doing the dial. And she said, see, when you get to 0, is it meant to click and just never come back? And I said, yes, yeah, that's fine. So that's what got me interested in. I mean, as an evidence-based dentist, I'm thinking, is this coincidence? Is it could have been any number of things? Did I make that up? Have I seen this properly? So that's when I decided I was going to study the masters, because I wanted to know the science behind it, and that led me to that. So once I had the masters, of course, there's only a handful of folk in the UK that have a master's in hypnosis, and that attracted the attention of some of the TV companies. So the first approach I had was from BBC Three, and they said, Mike, we're doing a program about the power of persuasion. Could we film you extracting a tooth with hypnosis? And I panicked and thought, well, that'd be great. It'd be wonderful to show it's possible. The first tooth that was extracted with hypnosis was back in like the 1830s, 1840s. So it's not a new thing. But that made me think, why are we still reporting this as this weird new phenomenon? We've had this skill for centuries, But I also panicked about giving across the wrong impression of dentistry, of hypnosis. I didn't want people turning up at my door saying, take my tooth out with hypnosis and go local. So the first case I did was actually a filling. And the guy came in, put the rubber dam on, and we did a dental restoration using hypnosis. And I thought, I have proved that good dentistry can be done with hypnosis. A year or two later, we had another contact saying, we are doing a program called Hypnosurgery Live, and there's somebody who's going to be having a hernia repair operation done live on TV. We would love to film you doing a dental extraction to be part of this show. And of course, I said the same thing. We've been doing it for ages. Why do we need to be proving? And I thought, you know what? If we're going to do it, let's do something a bit braver, a bit more 21st century. Let's look at implant placement. And I researched, it had never been done before, implant placement with local anesthetic. And I thought, if we can prove that you can place an implant with no local anesthetic, imagine the power that as dentists we have if we use some of these techniques in combination with local anesthetic. So you're using the things together. That's the real power of it. So I agreed, phoned up the Defence Union, is this okay? Anything I need to worry about? And they said, no, as long as the patient's comfortable and you've got local anesthetic on standby if they need it, it's fine. So I did this case with Abid Fakir. The lady had a sinus lift procedure done, and then the implant was placed. And I thought, that's great. I never have to do that again. We've placed an implant. It's been done. And then another TV company contacted us and said, we're doing a program about alternative therapies. Would love to have an extraction done under hypnosis. I thought, I'm never going to get away from this right. But I'd still like the idea of the implant placement showing the more modern dental techniques. So I got involved with Phil Friel for this case. And they came and filmed, and this is the one that is more widely known and viewed. The lady had her 2 central incisors extracted and 2 immediate placement implants placed, just using hypnosis and no local anaesthetic. For me, I thought that's me. I've proved that I've done it. I don't need to do it again. And then just a few years ago, there was one more approach, and it was Horizon. And Horizon said, Mike, we would love to see a dental extraction. But you know what? For my swan song with this, I'll do it. So this case was a bit more interesting. The guy I'd never met before, so I had no opportunity to test his hypnotizability or prepare him. He came up with the production team from London, and I met him the night before, and then on the day, we extracted an upper wisdom tooth just using hypnosis. I did my extraction just using hypnosis myself. So that was that one. Now, you asked about how it felt, obviously, during these procedures. I think in the earlier cases, I was probably more anxious. I remember, the one with Abid, the one with Phil. There is a degree of anxiety because you don't know what a TV company is going to do with footage. If the patient has a bad experience, how does that affect the profession? How does it affect the perception of hypnosis? Actually, the day that we filmed with Phil, we had 2 patients that day. So we actually filmed 2 and they both worked beautifully. So they selected the case that they wanted to use. A degree of anxiety, but as I said earlier on, I think as dentists, we're in that position all the time. Our bread and butter is we are doing something intricate and potentially painful with another human being, and it's exactly the same. So I had, other hypnotic techniques on standby. And these cases were not cases where we couldn't use anaesthetic. So we did have anaesthetic on standby if it was needed.
Mm-hmm.
We just didn't need it. We didn't need it.
That's amazing. I mean, such a great thing you've done for a profession, I think, and to do it in that way. And I'm actually excited to share the video with everyone. So I've got just one quick fire question, and I want to find out how we can learn more. Any sort of the sort of through the organization that you have as well, but wherever you think is the best next step for people who want to get more into either hypnosis or just managing anxious patients. But can you give us one quick fire gem in terms of a communication technique that you can give to any GDP that might benefit? And B, yes, how can we learn more?
Okay. So communication techniques, there's and language techniques, there's loads. Probably one of the best ones is learn some language skills. Avoid saying things like try to patients, try and relax, or try and open wider, because the word try suggests difficulty or you'll fail. So for kids, just say, I bet you can't open any wider, and you'll get a huge wide mouth. Avoid negative language. Don't think about an elephant. Elephant is in your head. So don't worry, this won't hurt. Worry, this is going to hurt. So negative language is a hypnotic technique. You can use it intentionally if you like, but most of us do it the wrong way. So, translate things into positive language. Relax. I think you'll be surprised by how easy that you find this today. Is a great tool. Training wise, for hypnosis, I would say go through, one of the medical and dental hypnosis societies. In Scotland, we've got the British Society of Medical and Dental Hypnosis Scotland. In the UK, there's the British Society of Clinical and Academic Hypnosis. They offer online courses. They offer weekend training courses and seminars and lots of really cool things. Again, for the general anxiety stuff, the organization that we set up called ISDAM. So if you go to isdam.com, there's also a Facebook page for ISDAM as well. And actually within that Facebook group, there's experts in sedation, hypnosis, language, and it's great because often if a young dentist puts a question in, getting answers from the top guys in the world at these things about managing the case in their suburban practice wherever they live. And it's lovely to see. So join the Facebook group as well.
That's what I love about these Facebook groups. I mean, the one that you said, I'm definitely going to join it and share the word. But also there are some restorative groups or surgery groups and orthodontic ones I'm involved in. And there's so much wealth of knowledge that we can learn from. So Mike, thank you so much for coming on and sharing your experiences, very unique experience to us. It's unique for you. It's like a normal day in the office. But there are so many things that we learned from that. And we also touched on tangents like the Akinosi, the Gow Gates, communication techniques, and how important it is to have the entire team on board. And there's little micro gains that you can get. So thank you so much for coming on and sharing all that knowledge with us.
Thank you, and thank you so much for the invitation. And I guess as a parting word to the guys that are watching here, this is a tough time in dentistry. Things are difficult just now, and dentistry is difficult just now with the extra things that we need to do. But focus on the stuff you enjoy, and try and get more of the stuff that you enjoy and get some of the passion back, because there is, I think, a real risk in the profession just now of us losing our passion, losing the vision of what it is we enjoy doing. So there's lots of patients out there that need your help, and there's some great work that you can do. Just go for it.
Amazing. Love it. Thank you so much.
As always, guys, thank you so much for listening right to the end. I hope you enjoyed that episode with Dr. Mike Gow. Like, wow. I mean, I just still can't believe the kind of stuff you can do with just words and body language and suggestions and hypnosis. It's just absolutely crazy, and hats off to Dr. Mike Gow. Thank you so much for coming on and sharing that with us. Remember, guys, my podcast is one of the only dental podcasts in the world where you can get CE or CPD via dentaltubules.com. And so it's great value just for that. If you're listening and you want to get your CPD, I'd go to Dental and Tubules to get that. You just have to acknowledge the aims and objectives and answer the questions. So you don't have to listen to me all over again. You just go ahead and answer the questions. So it really can't be any easier than that. And if you enjoy these episodes, if you do me a massive favor and share it with a friend, share it with a buddy, that's how the podcast grows. That's how I can find more guests and of highest caliber and how the podcast grows. So I really appreciate that if you could. And thank you, and join me for the next episode.